All right, looks like we're diving deep into eye health today.
Yeah, definitely.
You sent over a bunch of material from a nursing course, right?
That's right.
CNUR 204.
Yeah.
It covers a lot, from anatomy and terminology to cataracts, macular degeneration, and glaucoma.
Yeah. It's a pretty thorough course.
So, listener, if you're prepping for class or just super curious about eyes,
Right.
we're here to unpack it all.
Yeah, we'll break it down into easy to understand pieces.
I mean, it's a lot to take in, but we'll try to find those key takeaways.
Absolutely. So you can get a good grasp of the material.
What jumps out at you from all this? Where should we even begin?
Well, the first thing that strikes me is how in-depth this material is.
Yeah, it's definitely not your average eye health pamphlet.
No, not at all. This is geared towards training nurses.
Right, so they need that deeper level of understanding.
Exactly. So it's not just about the basics.
Yeah, it goes beyond that.
It really delves into the care perspective.
Oh, I see. So how nurses actually approach eye care in a clinical setting. That's really interesting. So our listeners are getting a bit of a backstage pass here.
Yeah, a peek into the world of nursing and eye health.
Okay, so before we jump into those complex conditions,
Right.
we need a good foundation, right?
Absolutely. A solid understanding of the basics is crucial.
And I see you've already spotted those common vision issues,
Oh, yeah, those are the ones we hear about all the time.
like myopia, hyperopia, stigmatism,
Yeah, all those usual suspects.
presbyopia. That
Right.
one's hitting close to home for me.
Huh, I hear you. I've got my reading glasses handy, too.
But this course material, it takes it a step further, right?
It sure
It
does.
goes into the actual structure of the eye itself.
Yeah, all those internal and external parts.
Cornea, iris, lens, retina.
The whole shebang. I feel like I'm back in biology class.
Well, think of it like this. The eye's like a camera, right?
Okay, I could see that.
The cornea and the lens,
Yeah.
those are like the focusing element.
Oh, okay.
The retina,
Uh-huh.
that's like the film.
Capturing the image. Exactly. And then the optic nerve.
Yeah.
That's the messenger, sending the picture to the brain.
Wow, that's a great way to visualize it.
It helps to break it down, right?
Absolutely. And speaking of the retina,
Yes, the red.
these notes get really specific about it.
It's a fascinating part of the eye.
Talking about rods and cones and something called the fovea.
All those tiny components that make vision possible.
What's so important about this part of the eye?
Well, the retina is where the magic happens, so to speak.
Okay, tell me more.
It's where light actually gets transformed into those neural signals.
Oh, wow. So it's not just capturing the image?
No, it's converting it into something the brain can understand.
That's incredible.
And those rods and cones, they play key roles.
Yeah, those light-sensitive cells.
Exactly. Rods are the night owls.
So they help us see in dim light.
Right, while the cones,
Those are the ones that give us color vision.
in sharpness too.
So we need them for those fine details.
Exactly.
And then there's the fovea.
Ah, the fovea. That's the VIP section of the retina.
Okay, what makes it so special?
It's packed with cones.
Ah, so it's all about that high-definition vision.
Exactly. It's responsible for our clear central vision.
Wow, so when I'm reading right now,
Yeah.
I'm using my fovea.
You got it. That's the fovea in action.
That's pretty amazing.
It is, isn't it?
We take our vision for granted sometimes.
It's easy to until something goes wrong.
And we have this whole section here on light reflex and visual pathways.
Ah, yes, the journey of light through the eye.
Sounds complicated.
Well, it's a bit intricate.
Can you break it down for us?
Sure, so light enters the eye through the cornea, right?
Okay, the cornea, that clear outer layer.
Exactly, then it passes through the pupil.
The pupil, that's the black part in the center.
Right. And the iris, the colored part, controls how much light gets in.
Oh, like an adjustable aperture on a camera?
Exactly.
Cool.
Then the light hits the lens.
Okay, the lens is behind the pupil, right?
That's it. And the lens focuses the light onto the retina.
And we already talked about the retina. That's where the rods and cones are.
Precisely. They convert the light into those neural signals.
And then those signals travel through the optic nerve to the brain.
Bingo. That's how we see the world.
It's an amazing process when you think about it.
It really is a symphony of light and biology.
But along that pathway, there are these incredible reflexes happening.
Oh yeah, those reflexes, they're essential.
The course material highlights 3 key ones.
Right. Those reflexes are our eye's first line of defense.
So they're protecting us without us even realizing it.
Exactly. Working behind the scenes.
So what are those 3 reflexes?
Okay, so first up we have the pupillary light reflex.
That's the one where our pupils get smaller in bright light.
Right. It's protecting our eyes from too much stimulation.
Like our eyes have built-in sunglasses.
A natural defense mechanism.
And then there's the accommodation reflex.
That's the one that lets us focus on things near and far.
Without our vision getting all blurry.
Exactly. So when you're reading a book and then look up at something across the room.
Yeah, my eyes adjust seamlessly.
That's the accommodation reflex in action.
Pretty cool.
It is, isn't it?
And finally, the blink reflex.
Ah, the blink reflex, a classic.
It's like our eyes' automatic windshield wipers.
Right, keeping them clean and protected.
So those reflexes, they might seem simple.
Yeah, but they're crucial.
They're keeping our eyes healthy and functioning properly.
Absolutely, they're essential for good vision.
Okay, I think we've laid a good foundation here.
I think so too. We've got those basics down.
Now let's dive into those eye conditions.
All right, let's tackle those one by one.
First up, cataracts.
Cataracts, a very common eye condition.
What's the one thing our listeners should know about cataracts?
Well, they're incredibly common,
Like, how common are we talking?
especially as we age. I mean, by the time we're 80,
Yeah.
more than half of us will have had a cataract or cataract surgery.
Wow, that's a lot of people.
It's a very prevalent condition.
So what exactly is a cataract?
It's basically a clouding of the lens.
The lens, that's the part that helps focus light, right?
Exactly. It's normally clear.
Yeah.
But over time, proteins in the lens can clump together,
Okay.
and that makes the lens cloudy.
And that affects our vision.
Right. It can make things look blurry, hazy.
Like looking through a foggy window.
That's a good analogy.
So it's not that the eye itself is getting weaker.
No, it's the lens that's becoming less transparent.
That makes sense.
And those blurry images, those are one of the main symptoms of cataracts.
Yeah, I can imagine that would be pretty disruptive.
It can also cause things like double vision,
Oh, wow.
halos around lights, or trouble seeing at night.
That all sounds pretty unpleasant.
It can be, but the good news is
Oh, good news. I like hearing good news.
cataract surgery is very common and effective.
That's reassuring.
So it's a treatable condition.
Yeah, but before we jump into treatment,
Right.
let's talk about what causes cataracts in the first place.
Okay, yeah, good point.
Because it seems like it's more than just getting older.
You're absolutely right. There are other factors involved.
The course material lists things like UV exposure.
Right. UV damage from the sun can play a role.
Smoking.
Yeah, the toxins from cigarette smoke can definitely damage those delicate proteins in the lens.
And diabetes.
High blood sugar from diabetes can also contribute.
So it's a combination of things, but aging is the biggest risk factor.
Definitely. Age plays a significant role.
And we can't stop time, unfortunately.
No, we can't, but we can make choices to protect our eye health.
Yeah, that's a good point.
And speaking of how cataracts actually develop,
Right, the course material goes into quite a bit of detail about that.
it does. It's like watching a slow motion train wreck for our eyes.
So what's happening at the cellular level?
Well, it all starts with those proteins in the lens.
Okay, the proteins that are clumping together.
Right. And over time, they become damaged.
Damaged how?
It's kind of like rust forming on metal, you know?
Oh, okay, I can visualize that.
So that damage disrupts the lens's metabolism. And that leads to that gradual clouding we talked about.
So the lens is slowly rusting from the inside out.
In a way, yes.
And as that clouding gets worse,
Yeah.
the symptoms become more noticeable.
Yeah, exactly. It's a gradual progression.
So early on, you might just have a bit of blurry vision.
Right. Or maybe you're more sensitive to glare.
Okay, but as the cataract progresses,
It can interfere with everyday activities.
like reading or driving,
Exactly. Things that require clear vision.
and the course material mentions different types of cataracts too.
Yes, there are a few different types.
Does the location of that cloudy buildup matter?
It does,
So
actually.
it's not just about how cloudy the lens is.
No, the location of the clouding can affect how we experience the symptoms.
Okay, so what are those different types?
Well, there are nuclear cataracts.
Nuclear cataract.
Those are the most common.
Okay.
And they often cause a gradual yellowing or browning of vision.
Oh, so it's like your world is slowly becoming sepia toned.
Huh, that's a good way to put it.
And there are other types.
There are cortical cataracts
Cortical.
and posterior subcapsular cataracts.
Those sound a bit more technical.
They are. But basically, each type develops in a different part of the lens,
Right.
and they can cause subtle variations in symptoms.
So knowing the type helps doctors determine the best treatment approach.
Exactly. It helps guide their decision making.
So while aging might be inevitable,
It is, unfortunately.
understanding these different types of cataracts
Yeah.
and the factors that contribute to their development,
Absolutely.
that can empower us to make informed decisions about our eye health.
Exactly. Knowledge is power, especially when it comes to our health.
So we talked about cataracts and what causes them, but what about the care side of things?
Oh, right, the nursing perspective.
The course material goes into a lot of detail about what nurses need to know.
It does. It's not just about understanding the diagnosis.
Yeah, it goes beyond that.
It's also about providing care and support to patients.
Especially after surgery, I imagine.
Exactly. Cataract surgery is so common.
So nurses are bound to encounter a lot of patients who've had it.
Right, or who are about to have it.
So let's walk through what are the key things nurses need to focus on?
Well, I think education is a big one.
Patient education.
Yeah, making sure patients understand what's going on.
So explaining the procedure, answering their questions.
Putting them at ease, basically.
Yeah, so they feel informed and comfortable.
And a big part of that is explaining what to expect after surgery.
Right, the recovery process.
The course material really emphasizes that.
Like how to care for their eyes.
Exactly, preventing complications.
That makes sense. They've just had delicate surgery.
Right, they need clear instructions.
On how to protect their eyes.
Exactly, things like hand washing, avoiding rubbing their eyes.
Oh, and those eye drops.
Yes, the eye drops, very important.
I remember my grandma telling me about those.
It's crucial to use them correctly.
To prevent infection, right?
Exactly, and to reduce inflammation.
So nurses need to explain all that.
Yeah, it's not just about handing them a bottle of drops.
Right, it's about empowering them to participate in their own recovery.
Absolutely, giving them the knowledge they need.
And part of that is recognizing potential warning signs, too.
Oh, definitely. Nurses need to educate patients about that.
Like signs of infection.
Yeah, things like increasing pain, redness, discharge.
So they know when to contact their doctor.
Exactly. Early detection is so important.
But it's not just about infection, right?
No, there could be other complications.
Bleeding, swelling, changes in vision.
Nurses need to be on the lookout for all of those.
So it's a lot of observation and communication.
Yeah, working closely with both the patient and the doctor.
And there's the emotional side of things, too.
Oh, absolutely. That's a huge part of it.
Cataract surgery can be a big deal for some people.
It can be anxiety-provoking, for sure.
Especially if they're worried about their vision.
It's a vulnerable feeling, having someone operate on your eyes.
So nurses play a key role in providing emotional support.
Yeah, being there for the patient, answering their questions patiently.
Addressing their fears and concerns.
It's about caring for the whole person, not just the physical condition.
That's a really important point.
It is, and this course material really emphasizes that holistic approach.
It's evident in the way they talk about patient education and communication.
Yeah, it's all intertwined.
So it's not just about the technical aspects of nursing care.
No, it's about the human connection as well.
Okay, I think we've covered cataract care pretty thoroughly.
I think so. We've hit the main points.
What about macular degeneration?
Macular degeneration. That's a different beast altogether.
It seems like caring for those patients presents unique challenges.
It does, because unlike cataracts,
Where surgery can often restore vision.
right, with macular degeneration,
Especially the dry form.
there's no cure.
So the focus shifts from restoring vision to helping patients adapt
To vision loss. Yeah.
and maintain their independence.
Exactly. It's a whole different approach.
And that must be really tough for patients to come to terms with.
It can be devastating, losing that central vision.
The vision we need for reading, recognizing faces.
It affects so many aspects of daily life.
So nurses need to be prepared to provide emotional support,
Oh, absolutely. That's a crucial part of the care.
helping patients navigate the emotional roller coaster,
Yeah, it's a lot of listening, validating their feelings,
helping them find ways to cope.
and connecting them with resources.
Resources like support groups
Yeah, where they can connect with others going through similar experiences
and low vision specialists.
who can help them maximize their remaining vision.
So it's about empowering them to take control.
Right, to find ways to live fulfilling lives despite their vision loss.
And that often involves practical strategies and devices.
Exactly. Things like magnifying glasses, large print books, talking devices.
Those can make a huge difference
They can. And nurses can educate patients about those resources.
and help them find the ones that best suit their needs.
Right. Personalized care is so important.
Because everyone's situation is different.
Exactly. And that individualized care extends to lifestyle modifications, too.
Oh, like what?
Well, the course material talks about things like quitting smoking.
Yeah, we mentioned that earlier. It's a big risk factor for AMD.
It is. And it can accelerate its progression, too.
So that's a no-brainer. Quit smoking.
Right. If you're still smoking, now's the time to stop.
What about diet?
Diet is important, too.
Are there specific foods that can help protect our eyes?
Well, the course material emphasizes a healthy diet.
Okay, so fruits, vegetables,
Exactly. Lots of colorful produce.
and those omega-3 fatty acids.
Right. Those are good for the eyes.
So we're talking leafy greens, fatty fish,
Salmon, tuna, all those good things.
and don't forget those sunglasses.
Oh, Right, sunglasses are crucial.
to protect our eyes from those harmful UV rays.
They can contribute to both cataracts and macular degeneration,
So wear those sunglasses, people.
even on cloudy days.
They're not just a fashion statement.
No, they're essential for eye health.
Now, what about those ARDs2 vitamins?
Oh, those are
They
interesting.
have antioxidants and zinc, right?
Yeah, a specific blend.
Are they helpful for both dry and wet AMD?
That's a good question.
Because I remember them being mentioned in the notes.
They are, but it's important to note.
Oh,
They've been shown to slow the progression of dry AMD.
so not a cure, but they can help,
In some people, yes.
but they're not typically recommended for wet AMD.
Right, because wet AMD is usually treated differently.
With injections, right.
Yes, to stop the leakage from those abnormal blood vessels.
So it's important to talk to your doctor,
Absolutely, before starting any new supplements.
including ARDs2.
Yeah, they can advise on what's appropriate.
And speaking of talking to your doctor,
Right.
the course material emphasizes regular eye exams.
Oh, definitely, those are crucial.
Especially as we age.
Early detection is key for both cataracts and macular degeneration,
It allows for timely intervention.
and can potentially prevent significant vision loss.
It's like going to the dentist for checkups.
Yeah, you might not feel any pain, but there could be underlying issues.
So regular eye exams, people, don't skip them.
It's an investment in your eye health.
Okay, so we've covered cataracts and macular degeneration.
2 major eye conditions,
We've explored their causes, symptoms, treatments,
and the important role nurses play in caring for patients.
but we have one more to tackle.
The third musketeer of eye conditions.
Glaucoma.
Ah, yes, glaucoma. The silent thief of sight.
That sounds ominous.
It is. It's a serious condition.
What makes it so sneaky?
Well, it all comes down to pressure.
Pressure in the eye.
Yeah, intraocular pressure, to be precise.
And when that pressure gets too high,
It can damage the optic nerve.
the optic nerve, that's the one that carries signals to the brain.
Exactly. It's like the information highway for vision.
So if that gets damaged,
It can lead to vision loss.
and the scary part is
The most common type of glaucoma
open-angle glaucoma.
often has no symptoms in the early stages.
No symptoms.
Not usually. People might not even realize they have it.
Until it's too late.
Sadly, that's often the case.
So you could be walking around with high eye pressure.
And not even know it.
Wow, that's concerning.
It is, which is why those regular eye exams are so important.
They can catch it early.
Exactly. Before any significant damage occurs.
Okay, so open-angle glaucoma is the silent but deadly one.
It is. It sneaks up on you.
Are there other types that are more noticeable?
There is angle closure glaucoma.
Angle closure,
That one's much less common.
but more dramatic in its presentation.
Yeah, it's not subtle.
What makes it stand out?
Well, in angle closure glaucoma,
Yeah.
the drainage angle in the eye gets completely blocked.
Oh, so the fluid can't drain properly.
Exactly, and that causes a sudden spike in pressure.
A sudden spike, that sounds painful.
It is. It's often very
But
painful,
what are the
but
symptoms?
usually pretty hard to miss.
Okay, give us a rundown.
Severe eye pain, headache, nausea, blurry vision, halos around lights.
Wow, that's a whole bunch of symptoms.
It's a full-blown ocular emergency.
So if you're experiencing those,
Oh, wait. Get to an eye doctor immediately.
like ER level urgency.
Yeah, time is of the essence with angle closure glaucoma.
So we've got the silent thief and the drama queen of glaucoma.
That's one way to put it.
How do doctors tell the difference?
Well, they'll do a comprehensive eye exam.
To check your eye pressure
Right, and examine the optic nerve.
for signs of damage.
Exactly.
Yeah.
And they'll check your peripheral vision, too.
So it's a thorough evaluation.
It is, to get a complete picture of what's going on.
And once glaucoma is diagnosed
The goal is to lower that pressure.
and prevent further damage to the optic nerve.
Right. That's the key.
So how do you lower the pressure?
Is it a quick fix like cataract surgery?
Mm,
Unfortunately, no.
that's a simple.
It's usually a long-term process.
Okay, what does that involve?
Often medicated eye drops.
Eye drops to lower the pressure.
Yeah, they help improve fluid drainage.
And sometimes laser therapy or surgery
If the eye drops aren't enough,
to create new drainage pathways.
exactly, to give that fluid somewhere to go.
So it's a bit like managing high blood pressure.
Yeah, it's an ongoing commitment.
You have to stay on top of it.
Exactly. Consistency is key.
Using those eye drops as prescribed.
Keeping those follow-up appointments.
And reporting any changes in vision to your doctor
Absolutely. All those things are crucial.
to protect your sight.
That's the ultimate goal.
Okay, so we've tackled those 3 big eye conditions.
Cataracts, macular degeneration, glaucoma,
We've explored their causes, symptoms, treatments.
and the essential role nurses play in caring for patients.
But this nursing course material also emphasizes prevention,
Right. Prevention is always better than cure.
especially when it comes to eye health.
It's easier to protect our vision than to try to restore it later.
So beyond those regular eye exams,
What else can people do to keep their eyes healthy?
so we've talked about how nurses care for patients with eye conditions, but this material also really emphasizes prevention, right?
Oh, absolute. Prevention is always better than a cure, especially when it comes to something as precious as our eyesight.
So besides those regular eye exams that we keep harping on about, what are some practical things that our listeners can do right now to take care of their eyes?
Well, a lot of it comes back to those healthy habits we hear about all the time.
Right, those general healthy living tips.
Eating a balanced diet, plenty of fruits and vegetables,
Gotta get those nutrients.
and those omega-3 fatty acids we talked about.
Yeah, those are good for the eyes.
Really good for eye health.
So fueling your eyes with the good stuff.
Yeah, exactly. And of course, I know we've mentioned it, but it's worth repeating. Quitting smoking is honestly one of the best things you can do for your overall health.
And your eyes will thank you.
Absolutely. Smoking is a major risk factor for so many eye conditions. Cataracts, macular degeneration, even optic nerve damage.
So if you're still smoking, listener, maybe this is the sign you needed to finally quit.
It's never too late to make a positive change.
And let's not forget about protecting our eyes from the sun.
Yes, those sunglasses.
Not just a fashion statement.
Not at all. Those UV rays can really do a number on your eyes, contribute to cataracts, macular degeneration.
Yeah, we talked about that.
So wear those sunglasses, folks. Make it a habit.
Even on cloudy days.
Yeah, UV rays can penetrate those clouds.
Sunglasses are like sunscreen for your eyes.
I like that analogy. Sunscreen for your eyes. Got to protect those peepers.
All right, so healthy diet, ditch the cigarettes, rockin' those shades. Anything else we should add to our eye health checklist?
One more thing. Be mindful of your family history.
Oh, right. Genetics.
Yeah, a lot of eye conditions can have a genetic component. So if you know that glaucoma runs in your family or macular degeneration,
Yeah.
you and your doctor can be extra vigilant, catch things early.
That's a good point. Forewarned is forearmed.
Exactly. Knowledge is power when it comes to our health.
Well, I think we've officially covered everything about eye health from this nursing course.
Yeah, we really dug deep into this material.
It's amazing how much we've learned from just these few course objectives.
It shows how complex our eyes really are and how important it is to take care of them.
And a huge shout out to all the nurses out there who dedicate themselves to eye care.
Absolutely. They play a vital role in preserving people's vision.
All right, listener, I hope you've enjoyed this deep dive into the world of eye health.
Remember, those regular eye exams, healthy lifestyle, family history awareness,
All key keeping those eyes bright and healthy for years to come.
it's an investment worth making.
And on that note, we'll wrap things up for today. Thanks for joining us on the deep dive. Until next time, keep exploring and keep learning.